Good afternoon, everybody. Thank you for being here. No new deaths over the weekend. Very good news. 203 neighbors during the pandemic directly related to COVID that we lost. Certainly, we continue to think about them and their families. Related to yesterday, we received 1,961 tests back for Onondaga County. Our 7-day rolling average for an infection rate is 0.66%. As a region, we received 7,664 tests over the weekend. Very good testing for the region. The region's doing very well. So very good news there. So just to give everybody kind of an update on testing, there's a lot of information. Things have changed. The national labs have built up some more capacity. So if you think about whether you're going to the Syracuse Community Health Center or whether you're going to a primary care provider for a period of time, especially if your test was asymptomatic, severe backlogs due to the national crisis. I spoke to different reps from the national group over the last few days. Right now, overall turn times for national labs are back to about 3 days, so that's very good. For specific cases, they're actually quicker. They've built up capacity. Our local labs, again, think of your hospitals. That's where a lot of testing is done for patients, for faculty, for procedures, but also we utilize that for some symptomatic testing where they need. Those labs are looking at really 24, 36-hour turn times. And then we were building up the rapid testing capacity that some of these facilities have for back-to-school testing. That rapid testing is going to be utilized for back-to-school testing primarily, and then we'll open that up strategically to the community at large. In addition to that, we will be doing saliva pool testing with Upstate in our schools. There was a saliva test approved by the FDA over the weekend, which could change the cost structure and the way that we do this moving forward. We do not have that specific test at this point. We're looking into it. And then we were the first community in New York to do wastewater testing as a way to screen and really first proof of concept with our partners at Syracuse University using our wastewater treatment facilities where we knew there was COVID, and then testing the wastewater to see if we found it. We did. It worked out so well that the governor gave a grant related to that so that they can do that. But we're going to be using this as a tool for specific buildings moving forward. We know that there's COVID in the community. We know that if it's in the community, it will be in the wastewater systems at our wastewater treatment facilities. But how do we micro-target using this technology? That's what we'll focus in on, and we'll talk more about that. But overall, very robust testing. And this is how we get to continue to reopen up our economy, our community in a safe way. We open up everything from a position of strength because of our low infection rate, but we utilize technology and best practices to continue to mitigate the risk this virus has. Looking at hospital numbers, 20 individuals are in the hospital, down 1 since yesterday. We have 6 individuals who are just waiting a negative test to return back to their home, their senior facility, wherever they live. Essentially, that leaves a total of 14 individuals in the hospital right now receiving care and 4 individuals in the ICU. So please keep them in mind, and let's keep them in our thoughts and prayers. Out of the hospitalizations, 15 Caucasian, 3 African American, 2 patients that they have not shared their demographics with us at this point. Looking at new cases, total cases to date, 3,551. New cases, 9 since yesterday. Out of our new cases, 1 travel-related, Alabama, 2 household contacts, 2 from senior facilities, 4 community spread, and essentially 9 cases, good number, good day. A little more than half those cases asymptomatic. So 5 out of the 4, which is always interesting when you find that and you find these cases to make sure that they get isolated. Active cases down to 158, down 16. I think this is going to be one of those weeks where, assuming we have low new cases, we'll see lots of recoveries. Remember, it's a 10-day period. If everything goes well, once you have COVID, if your symptoms, you start getting better, no symptoms for 7 days, 3 days. After 10, you get released. 2 weeks ago, we had a great week. We got down to about 108. Last week, because of that 10-day time period, not as many recoveries. Hopefully, we'll have a low infection week, and we'll see lots of recoveries to try to get closer to that 100 mark again this week. So off to a good start. When we look at recoveries to date, 3,195 individuals have recovered. That's up 25 since yesterday. And then when we look at who's been impacted, 2,018 females, 1,470 males, 293 under 19 years of age, 701 in their 20s, 476 in their 30s, 431 in their 40s, 523 in their 50s, 403 in their 60s, 299 in their 70s, 165 in their 80s, and 160 in their 90s. Certainly, those more social have essentially found pockets of the virus. I would just encourage folks who have, the summer cold, allergies. If you see this is happening right now, please get a COVID test if you got those. Let's be safe. For most cases, it's nothing. We had a situation in our household where my little one had a runny nose all of a sudden and a slight fever. We got a COVID test. We eliminated that as an option. He was negative, Trish. I know that you were worried. But essentially, this is what families are going to have to deal with childcare moving forward, going into the fall. So it's smart to start planning how would this work? Would you go to your doctor, look at other options, so you know what to do when it happens? Because you're going to have daycare providers, you're going to have schools, and they're going to not want your child in the building if they have any of these symptoms. So let's start thinking about those as parents, start planning for what to do. But this is part of the process. You got to eliminate the common cold now from being COVID. In the beginning of this process in March, we were on the back end of flu season. So it didn't impact us as much. Now we're going to be on the front end of it, so let's prepare as a community. Good news related to Restart. Very happy that bowling alleys open today, 50% capacity. Again, masks are required, every other lane. Please support these businesses. They've been on the sidelines. Good family fun. And then today, gyms, guidance coming out for gyms. From the state. We're still waiting for the actual guidance. I haven't reviewed it yet, but I do know this is how part of this is going to be a local inspection. And really the facilities can open up next Monday, but then there's 2 weeks after that to be inspected. This is what we want you to do. You need to go to the New York Forward page for business affirmations, just like every other business. Go on there, fill out your affirmation, get your plan, print your plan. We receive these business affirmations. So what we will then do, our team will then contact you, and we will schedule an inspection. So for the business side of things, you got to go to New York Forward if you're a gym. You got to fill that out. You got to print out. You got to affirm the guidelines. Keep your template. From that, each day we get a list of who filled out these affirmations. Our team will then call you. We will then come and do an inspection. We'll make sure everybody gets inspected and is compliant. So again, very good news. Let's get a workout. Not a bad idea. Before you go back to the gym, get your back to the gym COVID test. Good idea, especially when we want to continue to keep the infection rates where we are, so we can continue to make the case that we need to open up things in a safe way and bring more opportunity to you businesses. How do we do that? We keep the infection rates low, help make the case for us. But overall, very, very good news across the board. The infection rate, again, 0.66. I think today it was 0.45. In this number, what's in this number? The travel-related cases are in the number. We heard people say, well, what about when the students come back? They're in the number. We've had cases. They're in the number. We've had household contacts in the number, community spread in the number. Our senior facilities are in the number. All of this is in our number, and we're still where we are. So good job. Congratulations. We're making really good progress. One more thing for our small businesses, our gyms and our bowling alleys. The county IDA announced last week $500,000 for small business grants related to COVID-related expenses. We've earmarked $150,000 of that specifically for gyms, bowling alleys, the businesses that got opened up later. Please take advantage of that. You can go to reopen@ongov.net, send an email, or you can call 315-435-2210 to learn more about the program. But certainly we want to be able to help you cover some of these costs related to opening up, and we know that you've been waiting very patiently. Saying that, happy to take questions.
Do you know any idea of how many gyms are in Onondaga County? What will the workload look like for your inspection teams?
Yeah, it's a great question. We don't know the answer. We've debated about how the best way to roll this out, and the best way we think is that the owners are very engaged. They're going to go to New York Forward. We'll get that information and then we'll schedule. But from a resources standpoint, we got to see the state guidance too. Does this have to be just our health department, or can it be our whole team that's been doing this? Our team is our law department, our investigators, probation officers, and the health department all working together who've been working on this. So hopefully we can use that team who's been doing a lot of the enforcement anyways and go out and do the necessary inspections that are mandated via the state guidance.
Let's look at those closely. How many people would you be dealing with if it was just your health department? How many people are you dealing with if all of those are allowed?
Yeah, we really need the latter to work better and more timely, just because our health department every day is doing, we're tracing 9 different cases, right? And we're starting to get tomorrow's in right now. And so then you do those. On light days, your tracers are done in the morning. On busier days, they're there for a while. And we got other things going on now. We have the triple E virus. We have Lyme disease. We have to deal with all the various programming we do with working with families. We've seen there's been a lot of obesity, all these other issues in the community. These are all things that our health department does every day in addition to the pandemic. So hopefully what we've developed will be able to be the unit that can help do these inspections. But we'll make the commitment. We're not going to have somebody on the sidelines or start up, because they have a 2-week grace period, start up and then have to go backwards because of us. We'll get it done.
Have all those groups been involved in your inspections to this point of attested businesses?
Yeah, essentially. So you have different leads, and you have different, when we get complaints about different businesses, we're not sending out the rep from the health department, but essentially we've had a team of people working on this the whole time.
Did you know the burden was going to fall on you and the local government to check on the gyms before they opened or within the first 2 weeks they were opened, and what do you think about that?
We always anticipate in county government that these things are going to fall in our lap at some point. And so in this case, we're happy to play the role to get these businesses going. And we believe that gyms are critical to public health. And if you could see many of the notes we've received and have taken part in these conversations, you're talking to individuals who going to the gym, finding something in their life has helped them tremendously with their mental health. Many people have reached out to me who borderline diabetes before hit the gym, worked out good, and then were able to hold that off, now have diabetes. So this is a bigger thing. It's important from a public health standpoint that people can go and get the proper exercise in a way that works for them. Not everybody can go loop the lake and have a good workout at Loop the Lake, you know, you need to go and you need the trainers sometimes. You need to have that more of a structured environment. So we're happy. It's a big win. You know, we've felt these business owners' pain. We felt the community's pain. We've had law enforcement agencies reaching out to us saying we got to get back. Doctors reaching out to us saying, please, 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 we got to get back. My patients need this. So glad that it happened.
So they're allowed to reopen the 24th. You mentioned a 2-week grace period. They're all allowed to reopen, and then within 2 weeks, they have to be inspected by the
Our
county?
understanding is within the 2-week period they have to. So essentially we have 3 weeks worth of you know, inspections to get the job done. And
So
keep
this
everybody
full week and then 2 weeks after the 24th.
Correct.
And what kind of commitment can you make to these businesses that attest about how quickly they'll hear from you and how quickly you'll get to them in person?
Yeah, as soon as they start coming in, you know, when they attest, we'll start making the appointments.
I know that you've been working with gyms. Do you have any plans in front of you? Because I know that you were trying to do a pilot program, and
I think where the state went with that is that they were looking at us as a pilot community, and then I think when you take the data-driven approach, the data doesn't lie. And so when we've been making the argument, look at our infection rate, somewhere between 0.5 and 0.8, and why not? You know, why can't we, right? When the state's infection rate goes under 1 now for how many straight days, they have the same argument in other regions. So I think instead of just doing a pilot, they said, the data says it's time to get moving, so let's go.
How about indoor fitness programs or classes? I read part of the deal is it's also up to local governments to determine if they'll be permitted. And I think I already read New York City said for now they're not going to allow that.
Yeah.
What are you thinking on that?
We're going to look to see read the guidance on that, Jim, and see what it says. I heard the same thing you heard, so I'm interested in seeing what the state's concepts are. I know internally we have our own belief system that we've developed with Dr. Gupta and her team and our team about what's safe and what's not related to physical distancing. And we've tried to apply these same principles across the board. So we'll have, once we see the state guidance, I'll have a conversation with Dr. Gupta about what we believe is the safe way to do these types of activities, and then we'll be telling you all what the decision is.
Knowing you're the man in charge of really inspecting these businesses, you're the top of the ladder. Have you heard from gym owners today that maybe you personally know or your inbox is available to them and they're like, hey Ryan, get us on the schedule? Yeah,
the best way to get on the schedule, we'll do a first come, first served basis. So get in, get your affirmation done. We'll get it reported to us from the state of New York, and then first ones in the list tomorrow are going to be the first ones getting scheduled.
So nobody's scheduled at this moment?
Not yet. Not yet.
For tonight's meeting with the Onondaga County Teachers Association, what are you hoping to get from that? I know a lot of teachers have anxieties right now. What are you hoping to tell them?
Yeah, I think what we want to do is talk about what we are offering with our emergency management team, our partners at Upstate, Essential Health, Cayuga Medical, with back-to-school testing, and what the plan is related to testing moving forward, and how by building up this infrastructure, there's a way, in our opinion, and our opinion's based off of data, that we can do this safely, and hopefully that helps. And that's what it is. It's about delivering information. I know there's a lot of anxiety, and I appreciate all the anxiety. And I think the plans have been, for parents, they're as flexible as they can be. If you have the ability to keep your child home, you keep your child home. Certainly, I know what districts need to do right by their employees who have pre-existing conditions. But when you look at where we are, and we got to look at everything from the macro level in our own community. So for Onondaga County and Central New York at large, we are in a position where we have a very low infection rate. So the data tells us most people that are going into the buildings don't have COVID. So how do we build on that? We test them, and if they don't have a positive COVID test, then we got even a better plan that the folks going into the buildings initially don't have COVID. And then really it's about the proactive testing. What are you going to do? Who's going to run that? And I think they should be confident with the partners. We wanted to partner here because the districts don't have the expertise to do this. Nobody had this type of expertise in March, but we've developed an expertise managing this process with our emergency management teams and with our health department and our community partners. So we'll be doing that, and hopefully that will make these educators feel a little bit more comfortable. In addition to that, they'll have the proper PPE they need. And so when you take all this into consideration, it's about really mitigating the risk of catching this virus as small as you can get to. And I think we're doing everything humanly possible. And I think it's, really at some point we'll be able to look back and say, job well done, just like we looked at this whole restart process. Nobody thought in phase 1 infection rates were going to go down. Nobody thought they were in phase 2 or phase 3 or phase 4. They did. Everybody thought they're going to go up and how much of a spike would be acceptable. But each step of the way, we've beat the infection rate back down so low that you could take a little bit of a bump in new cases and you wouldn't even realize it because your community spread got lower, but then you took the travel cases in and your overall infection rate didn't move. So, there's another opportunity for us to engage with the public and engage with, these educators. So hopefully they get something out of it.
The governor reiterated today keeping movie theaters closed. Is that the remaining group that's still left in the dark as to when they can reopen, or are there others?
Yeah, I think you got movie theaters. Again, some of these national chains haven't pushed the envelope. I think right now you're starting to see a little bit of a push there. Certainly, there needs to be more clarity to the hospitality industry. Right now you have the federal court case, the federal decision from the Northern District. You have the state appealing that. And so I think that industry needs clarity. That's a very important industry that we need to get off the ground. And there's certainly certain restrictions that we would be supportive of related to testing out-of-state guests and whatnot that don't exist today, but maybe we can get those incorporated if we can all work together on a plan moving forward.
Testing, is that going to be rolled out right at the beginning of school, or how long is that going to take?
Yeah, so it's been approved. So we'll let the scientists determine what they think is best as far as how quickly a pool test is done. The goal is educators, faculty of the districts tested the week before going back. High school students tested the week before going back. Those are two very, very large tasks. We need the faculty to want to get a test, and we need the parents to want their kids to get a test. They should want. The younger demographics related to really I'd say you're 17 to you're 29, that's where the virus really is right now. And so that's where we're seeing the cases. So the best way to get our arms around all this is to get everybody tested. Teachers fall into that demographic, high school students do. And so certainly as we've done better, we've all been exposed to more people, whether it's at a family function or whether you're going out to dinner and seeing people. Everybody's living their life. We're all exposed to more people. So the way to keep our arms around this is to test any sign of any symptoms, get a test. And then certainly this is a great effort that our emergency management team's taking to really work on this moving forward. So we want everybody to participate in this because it's taking a lot of work to make this happen.
You mentioned, I believe, Andrew McMahon getting a coronavirus test, but you also tweeted yesterday about people with allergy-related things. Have you seen a case where somebody was maybe walking around thinking it was allergies, but then later tested positive?
Yes. Yes. So we've seen recent cases where folks have light symptoms, summer flu, whatever you want to call it, and they had COVID. And that's led to other family members getting it. So that's something that most cases, that probably isn't all, it's probably 1% of the scenarios, but it's happening. So if you have symptoms, your insurance isn't going to bill you for it. Go go get a test.
Did you go with your son to get tested and kind of give him some moral support, get tested with him?
I was right there, Trish. Andrew is a champion, and if we got a rapid test, and if young Andrew had COVID, I was certainly getting a test right then and there. He took one for the team again, we will. My pledge has been related to the diagnostic test that if I have any symptoms, I will get a test immediately. And so if Andrew had COVID, there's no way I wasn't exposed. So the good news is Andrew, COVID-free.
All Andrews are champions,
Well,
just so you know.
It's got to be something with the name, right?
This is a data question. The people that are going to get tested with symptoms, are the majority still coming back negative? Are there still other elements out there more likely causing illnesses than coronavirus?
I would assume with an infection rate right here, and it's an assumption, Andrew, but with an infection rate this low, most people who have symptoms probably don't have COVID. Even in the peak of this, we saw 8%, 9% were really the averages. So at this point, with the virus being beaten back down as much, I would say most symptomatic cases are non-COVID. But we track how we're getting our data now. There's so much asymptomatic testing being done that it's very difficult to track that.
What do you think about gyms having stricter reopening guidance than schools with 33% versus 50% capacity and they need the air filter? Like, does that make sense?
Well, I think you're going to see schools and districts should be doing this and preparing for this, and hopefully they'll get federal aid to make the necessary upgrades to ventilation systems. But I think it's I don't know if they're stricter. I guess that's in the eye of the beholder, but I understand where you're going. With a gym, you're essentially you're sweating, you're breathing heavily, you're working out. So the way that the virus is transmitted, I think, is the issue there. So how do you do it to physically distance more? So I think that's where the guidance is going there. I think that's the rationale. There's a lot of physical distancing in these guidances for schools, and one could make the argument that the students aren't exerting themselves in the same way. I don't think they're doing gym class or anything like that right away. But certainly, I think that with gyms, it was a lot to get here, to get the state where they are. So we'll see the final guidance when it comes out, but it's not surprising that it's a conservative guidance to start to see how it was. I know they were very concerned about the risk level with gyms, and so we made the cases that this can be done safely, and that this is bigger than just COVID to the public health. And for the mental health, other physical things, we're hearing from medical professionals saying we got to get this done. So when you weigh it all, we got gyms open. They have limitations. The best way to get those limitations to 50% or 65 or whatever it is to make sure that there's no spike in cases. So a good way, if you've been asking to get a workout in, get a COVID test. Make sure you're not an asymptomatic carrier.
I know you love addressing national controversies. I was just with Senator Schumer, who was in Auburn, advocating for the changes to the Postal Service be stopped and retroactively returned to normal in terms of equipment and sorting and those kinds of things. I know you've talked about and been asked about the accuracy of mail-in voting, but what specifically do you think about this controversy of defunding and changing the operation of the Postal Service?
It's tough when it becomes a political football the way it is what's real. So I'll let you folks figure out what's really happening and what's not. It's just, in Washington, D.C. right now, things are pretty polarized. And that's troubling when you're dealing in the heart of a pandemic, and the pandemic's in the heart of a presidential election year. So you got senators, you got congressional members, and you got the White House all up for grabs. So you're not going to eliminate the politics, unfortunately. So how much of the concerns about the post office situation are accurate or not, I don't know, and quite frankly, I haven't had time to try to figure it all out. I know that you all will, and so certainly messing around with the way mail works doesn't make sense. It just doesn't make sense. So I don't know if that's happening or not. I'll let you guys figure that out.
And the senator, I actually had to ask him on the backside about the next stimulus package, local and state funding. It almost seems to not be a priority right now on the national stage because of the post office situation. What's your read on where that stands? Because that money's critical for you. It was in July. It is in August. And now with the work your teams will have to do to inspect gyms, your workload isn't getting easier.
No, the work there's just more work, and there's likely going to be structural changes made in our workforce. I've been talking to the leadership at our legislature that I'm going to ask for unprecedented flexibility, and hopefully they'll give it to us coming up soon, because there's just so many variables, and I don't want to have to restructure the workforce. I've been essentially begging Washington, D.C. for months now for the help that's needed. So this is just very difficult. So I hope that this post office situation doesn't get folks so polarized that they don't get to the table for what is very important to many of us, and that's taking up a new stimulus package, whether it's direct relief to households, solidifying unemployment benefits, helping state and local governments, which is helping fund your health departments, your public safety departments, your social service departments. These are people. These are people that pay taxes and contribute to the economy. So, for us, let's, get back and figure that out. There's going to be, people are going to be sick and tired in the next 75 or 80 days of the politics back and forth.
When was the last time you talked to Representative Katko about the stimulus package that
Yeah.
come?
Yeah, we talk almost every day. So the Congressman and Senator Schumer, Senator Gillibrand, we've had conversations. Our New York delegation isn't the problem here. I think sometimes both sides stick to their positions and they harden themselves early, which makes it harder to get to the middle. And I think Washington gets in a position sometimes where they put in poison pills in the beginning into legislation that they know the other team's not going to agree to, and then they try to negotiate away the poison pills. And that's just, I get it, I understand it, but that leads to these long processes. And meanwhile, the people doing the work back home are suffering. So the congressmen, the senators, they're with us. I know where they stand, and they've been advocating for us. It's just we got to get some movement here, and we're out of time. That's the reality. We're out of time.
Their ball field for voting. Are you guys thinking of anything like that? Like any major?
Yeah, there's nobody's come to us saying that they think the system. Remember, we have early voting. You have absentee ballots. So if you request a ballot for any reason, they'll mail you one, and then you mail it back in. There's election day, so a lot of voting. These are all new things here to make voting easier. The state gave us money for the first year. They didn't give us money this past year, which we don't appreciate. And so this is not an issue in Onondaga County. And if the Board of Elections commissioners think this is going to be an issue, I'm sure they're going to come talk to me. I think it's important when the national back and forth debate, you look at it through the local level. Nobody has come to us and said, we're concerned that we will get a vote out and it won't be counted. Because there's so many different chances to vote. And again, early voting, many days early voting, there's not a lot of people with in-person voting. Probably even Dr. Fauci said it's safe under the right circumstances for in-person voting. So, in our community with the infection rate where we are, I don't think trying to manufacture a solution to something where there isn't a problem yet makes sense when we don't have money.
What have you talked about in your control rooms recently?
Today was kind of just a back and forth related to reopening some of the things some of the challenges we're going to see. Certainly, when school gets started, certainly we're trying to get an assessment of how many kids will be in situations that aren't ideal for learning because of their parents being at work. That is a county-wide problem, a regional problem, a statewide problem. So what does that mean for some of these other groups that want to be a solution? So those are conversations that are starting to happen. But overall, I think the mood of the control room was pretty good. Your Central New York control room's been pushing very hard for progress and restart today. Anything else?